Thank you very much, Ministers, colleagues, ladies and gentlemen. I'm glad to see that there's a good number of you who have stayed to the end. I'm very pleased to have participated in this important conference discussing with you ways to best promote healthy lifestyles. Health prevention and promotion are priorities which I think we all share in this room, and nutrition, physical activity, alcohol and tobacco deserve our full attention as health determinants. At this Presidency conference, I have heard most encouraging words by all present, especially on the urgent need to promote healthy diets and regular physical activity among children. We've had particularly impressive national stories from Latvia, Hungary, Estonia, Norway and elsewhere on how to organise school meals and to secure nutritional quality in schools. Specific diets as well were discussed and the role of dietitians. Reflections on food promotion and advertising were also discussed, and ways to involve industry, trade and commerce in making the problem less serious. We have mechanisms in place at European level and also in national administrations to involve different stakeholders to try and involve them in solving the problem. We've also heard about the importance of healthy school environments to promote healthy lifestyles from the youngest ages. And we've been told of the potential of mobile applications earlier on this afternoon. Several speakers have addressed physical activity from Norway, Finland, and the Toolbox in Kindergartens project, which we heard about from Greece. I was also impressed with the very strong emphasis yesterday during all the interventions on the issue of health inequalities, because obviously the last thing we need to do is to make the problem worse for the poorest in our societies. And above all, I must say I'm very impressed with the level of enthusiasm and commitment of all of you here in the room, who are all obviously moving in the same direction and anxious to try and improve the situation. So I think this is a very good way that we celebrate the first anniversary of our European Action Plan on Childhood Obesity, which several of you have referred to in your presentations. It's exactly 1 year since we adopted this text. And I believe that it's this kind of coordinated approach where we can share experiences and share resources sometimes that can help us to move forward. Although, of course, there are many regional and local differences between the member states, nevertheless, I think we recognize from the data that childhood obesity is a growing problem for many of our member states. We also have a common understanding as well that many of our children and adolescents do not have a sufficient consumption of vegetables and fruit. And I think this is also something which came out of many of the presentations, as well as the lack of physical activity in many age groups. So this event was really an occasion where we were able to learn from each other and to see the good practices which are being rolled out and worked on in some of our member states. And also I noticed some of you made more negative presentations explaining why things were not working at the national level. I think that was also useful. So whatever we do at European Union level, of course, has to be done in respect of subsidiarity. It's not the question of the Commission or the Council or the Parliament at European level imposing solutions on the member states. It's for the member states themselves to reach solutions. But we do have a common problem, so I think there's a lot of work which we can do together. And we've seen how the health programme, the research programme, the Erasmus programme can feed some money into finding solutions on the national level through different projects. We know that healthier lifestyles, including balanced diets and physical activity, are important. We also know that they can prevent personal suffering, improve the sustainability of our national healthcare systems, and contribute to the productivity of the economy. And I mean, if you need proof of that, you just have to remember the figures we've just heard from the last intervention. I think the figures are really amazing when you consider the costs of chronic diseases in our society. So these are arguments which we all need to use in convincing those around us of the importance of making action on chronic diseases and on obesity in particular. From speaking to delegates in the coffee breaks, and the coffee breaks are very useful at this type of occasion, or the lunch breaks, from speaking to delegates, there was a common message, I think, from many of you, and that's the lack of capacity at national level in your home administrations. Maybe I'm preaching to the converted here and just telling you something that you already know, but many of you made the remark to me that to have a European action plan, to have European projects is not the solution if you don't have people on the ground to actually do the work. And I think this is one of the areas where we need to think in the future about whether this is a blocking point at the national level or at the regional level. Do you have sufficient staff? Do you have sufficient resources in the health ministries in order to carry out work on chronic diseases or on obesity? So this is something I think we'll have to come back to. And one of the solutions here could be to try and leverage the support from parents, the support from NGOs, the support from the industrial sector, in the food sector, from health professionals as well, and also from NGOs. So I think we have to think a little bit outside the box to see how we can have a multiplier effect, and not only focus on the number of people in the health ministries, but also to see how we can get allies elsewhere. In the last session, there was an interesting point as well about mobilizing the media, and I think that's really something that we need to do in a positive way, so that we're not just scaring parents and scaring kids, but also giving positive messages about lifestyles. So really, the take-home message which I have from the Commission side, and we're very happy that the Latvians organised this event as part of their presidency, and the take-home message which I would take is that the size of the resources which we're putting into solving this problem at national level are not matching the size of the problem itself. So if you look at the size, the cost of these diseases, these childhood obesity-related diseases, these chronic disease-related costs to our health systems, what we are spending on prevention and health promotion is zero compared with the size of the problem. We're talking about less than 3% on average of our health budgets which is spent on promotion, and that just doesn't match the size of the problem. So I think there's a political issue there as well of the balance of the budgets. There's a political issue about the resources which we're putting into prevention, and that's really, I think, one of the take-home messages which we would have. So I'd like to just thank our colleagues in Latvia for having put so much work into organising the agenda, having organised all the speakers, all of you here today who have been very committed to following this discussion and challenging some of the presenters. And again, thank you very much for your interventions. Thank you.
Now I am delighted to announce the next speaker, Dr. Agis Tsouros, the Director of the Division of Policy and Governance for Health and Well-being from WHO Regional Office for Europe. Welcome.
Thank you very much. Continuing to wear my dictator hat, I would like to stress what I started saying before. I think health deserves to be much higher on our political and social agendas. We have learned that health cannot be perceived just as an expenditure for governments. It is a crucial investment. It goes hand in hand with social, economic, and sustainable development. It has to be up there. That's why governments have to be judged for how they perform on the health of their people, and every sector, every level of government should be held accountable and should be encouraged to contribute to the health of the people. I think that's probably the most important message, because today we talk about children. Children are the biggest resource of any society. And if a government recognizes the importance of health, then that's where they should start first. When our colleague from the media was saying before, talking about obstacles, I was thinking that something that we have today that we didn't have before, in addition to evidence, is political legitimacy to act. Today, there is far more political legitimacy at the global level, at the UN level, at the European level, at national levels to take action. Because the problems or the challenges, however you define them, are really big and escalating. And I know sometimes we don't want to limit our discussions to economic arguments, but we have also to think of two factors. One is our aging societies. If our societies age as they are, because we are doing better in many ways, then the chronic diseases and the multimorbidities in the end are going to collapse our health systems. Unless we act now and early, we are going to be facing major problems down the road. And if we are to think about healthy aging, not in an old-fashioned way, but in the life course kind of approach way, investing in healthy children, you get actually at the end healthier older people. And that's really the essence of a lifestyle approach. There is also evidence, you know, all these myths. For years, we were saying, oh, well, we can't invest much in prevention because ministers of health only stay in office for 4 years and they will not see the dividends of their efforts. Where new evidence, the evidence that we have now, the evidence that has informed Health 2020 is based on new results that show that you can gain very quick dividends from prevention interventions. You don't have to wait forever. There are long-term benefits, but there are immediate benefits to justify action. I also would like to resonate what Dr. Ryan was saying before about capacity. It is a big problem. There are fabulous strategies, plans, national plans, local plans that remain unimplemented because there is no adequate capacity. And we should remember that in all our efforts, we have to think of that anemic, let's say, relative of health systems, which is called public health. We have been thinking and thinking again and again about our health systems, and we have forgotten the population-based approach. Public health, strengthening our public health functions and infrastructures. That's very important. But I don't want to give another presentation, and I don't want to repeat what so eloquently previous colleagues said by summing up their impressions and their take-ons. I wanted only to re-emphasize that we must be able to communicate better with other sectors, with other stakeholders. We must create opportunities like this to speak to each other, to understand where we are coming from. It will never happen otherwise. Or we will continue doing fragmentic, maybe interesting interventions, but not the interventions that could pay real dividends in the long term. We must understand that social responsibility can only, personal responsibility can only be understood in its social context. And the interplay between the two is what is going to make us a responsible society. But we cannot just focus on one at the expense of the other. The idea of supportive environments, easy choices, continues to be probably the cornerstone of health promotion. You want people to lead healthy lifestyles, you have to understand the context, you have to make it easy for them. And as you hear also by the previous speaker, the various companies and industrial and private interests make it very difficult. I mean, we are up against forces that spend and invest far more into, let's say, tempting us to take unhealthier lifestyles. That's why we need to act as a whole of society, as a whole of government. A minister of health alone cannot do much. It's as simple as that. Or do you want a figure that, I don't know if you are aware for, if someone asked you, what is the percentage of the contribution of a health system to the health of people? Do you know what it is? Even when a health system works optimally, 15 to 20%. The rest of the contributions to our life, to our health, come from our working and living conditions and our lifestyles. So where is the burden? Where is the expectation for health? We're obsessed with health systems, we're obsessed with health systems budgets, but in reality, even if you look at the curve of how our life expectancy has improved over the last couple of centuries, you will see that medical technology and all that came towards the end. It was our improvement of our living conditions that made the difference. Do you know that urban planning and public health 100 or 150 years ago were working hand by hand? Then they went their separate ways, and that created many problems. There is a wealth of good, inspiring examples that were presented here that we can learn from. But please remember one thing, sustainability. Even I heard colleagues in the corridors, in the cafeteria, that even the very successful fruit and vegetable EU project is threatened to be discontinued by some forces that are critical of this. I don't know to what extent this is true or not, but what I'm seeing is everything we do must have a tomorrow. Great examples, there are plenty. How do we make them last? How do we make them become part of the commitment of the mainstream of the services of the conditions we offer, in this case, to our children? So, and of course, last but not least, I would like to say that don't forget the have-nots. Don't forget people in poverty. Don't forget those who are challenged by their working or social conditions. Inequalities is the biggest problem of this continent. Health inequalities. You know what is the irony? 30 years ago, we lived shorter lives, but health inequalities were like that. Today, on average, we live longer lives, but health inequalities are like that. Who is responsible for that? What are we going to do about that? It is not only a moral issue, it is also an economic issue, and it is a social justice issue. So that's something also to take and to remember, whatever we do. And I think and I would like to thank very much the organizers for this great opportunity. And allow me, Mr. Minister, and I hope you will forgive me for the bad pronunciation, to just say just a couple of words in Latvian. I would like to say, paldies par lielis.
Thank you very much for the wonderful conference. We are going to be happy about future cooperation, Mr. Minister.
Now it's indeed a pleasure to welcome the Minister of Education and Science of the Republic of Latvia, Mrs. Mārīte Seile. Please.
Dear conference participants, I didn't have the honor to participate in the past 2 days of the conference, but I have received information from my colleagues about what you have achieved and your conclusions over these days, and I would like to say a few words to show my political stance as Minister of Education and Science, who also is responsible for sports and youth issues in Latvia. And I hope that the things that I'm going to emphasize also correspond to what you have talked about in this conference. I'm quite sure that in order to promote understanding among children about what healthy lifestyle is, it is very important in the curriculum to have questions on physical activities and healthy lifestyle, that children at the educational institutions have to be fed in a healthy way so that they would have fewer harmful food and sugary drinks. I'm sure that it is very important to take care about meaningful activities after classes. And I would like to state that definitely young parents and teachers have a huge role to play, and the parents have to have a huge role to play, and the teachers at school would only be a support mechanism. But this is also about challenges, and I'm sure that the school is an institution that solves challenges when families do not give a good example. So then the school has to step in, and through its curriculum and through its learning process has to show a good example to the child in healthy lifestyle. Certainly, I would like to stress the idea that we heard already in the afternoon about intersectoral cooperation and its role. And I would like to mention here not only educational institutions, but also municipalities, NGOs, businesses, and definitely also the media. If we speak about policy documents, then in Latvia, issues related to insufficient physical activities among children are part of the guidelines for sports, and the part of the priority things for children are sports, and for young people, for children, and for all people. And speaking about sports facilities and educational institutions dealing with sport, I think we want to act in providing more modern and contemporary possibilities for doing sports at schools. Sports policies is also an important issue in the European context, and the idea that we should work together to promote sporting activities is also shown by the European Common Action Plan on sports. And as we have taken up the initiative to do sports promoting activities, these actually have been the first guidelines on physical activities and their role in healthy lifestyle taken by the European Union. Last week in this library, we had also a conference on sports, and representatives from the sports area, and grassroots sports was mentioned also as a priority in the context of Latvian presidency. Also, your dictator game was seemed to me quite interesting, and I was also sitting and thinking there, what would I say? And I would say that I, as a minister rather than a dictator, we want to work on a new curriculum in Latvia, and I hope that in this curriculum we might have a topic on healthy lifestyle in each subject, in physics, in mathematics, in chemistry, in history, to speak about sports and healthy lifestyle and their role through examples and through specific topics. And as if I were a dictator, I would close down the elevator in the Ministry of Education and Science, because healthy lifestyle certainly is a question of changing behavior. and habits. And if we might change our habits, it would be a good step towards healthy lifestyle. In the cabinet, sometimes we have some, maybe not too lengthy, but very important exchange of words about what is more important, health or education. I think that this conference is a good example when these two themes come together and we have a good possibility to interact and to gain success. It is very important that policy documents would not remain just policy documents, but would be implemented in all the areas of life. Thank you.
My honor to invite the Minister of Health, Dr. Guntis Belēvičs, to conclude this session and give a warm farewell. Please.
Cienījamās dāmas, godātie.
Dear ladies and gentlemen, dear peers or co-thinkers, I would like to state what I thought when I answered Dr. Bosch about what I would do as a dictator and why I mentioned the food scheme in Finland, the school food scheme in England. Like Dr. Alpenis, I'm going to go back 30 years ago when in Switzerland at the company La Roche, Dr. Reichstein knocked and offered to sell the chemical patent of vitamin C, and nobody needed his invention. We know how important metabolism is and vitamin metabolism is, but nobody needed vitamin C. And they also said that there were no diseases that could be treated by vitamin C except avitaminosis, but it was quite easy to deal with it through sour cabbage. And you could also buy some lemons and oranges. Then there was a lot of correspondence and at the end, there was not a marketing department there, but then there was the idea how good it would be to tell the German people that they all have vitamin C deficiency, a completely new disease. And that was a turn in the history of healthcare, something that is typical for one individual becomes an average statistic value in the public. The company Roche was telling how important it was to consume vitamin C. They also pay all the journalists for every time they mention vitamin C. They also measure the concentration of vitamin C. They establish Roche Diagnostics, which is definitely a good thing, and they measure the vitamin C concentration. And in the course of 20 years, when Germany became the world football champion, athletes put a stop to this parade. They had the orange juice enriched with vitamin C. How did Roche achieve it? The school doctor, the school teacher, and the child heard that it was important to use vitamin C, and they brought that information to every household in Germany. Why is it important for the Finnish food scheme? Since 1948, they have changed the law on education that every child from the first form to the last form now has free lunch for government money. through the years, this has become a very important instrument of education. Children are not only fed freshly prepared lunch, but every Finnish child is taught what to eat and what not to eat, what is healthy and what not. And every small child has told that to his parents and to his grandparents, because the child's mouth only can speak the truth. And this is when we exchange words here with the Ministry of Education and Science, but I will mention a medieval doctor and what he said. Health is not everything, but everything without health is nothing at all. And with this idea, we should approach our problem. And when I heard what our Luxembourg colleagues said, that we have to allow children work, and they have to be taught to work. This is very important. We have to involve children in all types of activities, in sports activities, in dancing, in working, in work activities. And it is absolutely important to teach our children and our grandchildren to cook freshly prepared food from natural products. And believe it or not, that not only men love through the stomach, but also women, and those boys who are going to learn from their mothers and from their teachers, who are going to be able to cook later in they will have also a more happier life after that. Dear colleagues, thank you very much for your presence here, for your interesting discussions and speeches. Thank you very much that you are still here till late afternoon, second day of the conference. I only can conclude that it was interesting for you to listen, and let us do everything to help our children, our European children. Let us save our children in Europe, and let us tell every household in Europe what is healthy. Thank you very much. I want to thank our cooperation partners, also the World Health Organization, the European Commission, and everyone here. Thank you.
Thank you, ministers and honorable experts. I would like to extend my personal touch, thanks and comments about the conference. Certainly, it had been very successful in bringing out issues and in highlighting some of pertinent aspects of healthy lifestyle promotion. There is just one final step left before we part. I would like once again to ask everybody to fill in a questionnaire concerning the content and organization of the conference. We appreciate your time and help. Thank you for your active participation. It had been very successful in bringing out issues and in highlighted once and once again about importance of health promotion. I just want to outline that all conference presentation will be available on the website of the Ministry of Health. The link to the website will be sent out to all conference delegates within this week or during next week. And there will be a conference report, including conference conclusion and main accents of our discussions, which will be available on the same time in website, beginning of April. And I would like to outline that this report will be presented during the informal health ministers meeting in Riga on 21-22 of April. And so, once again, this conference has been a success because of your efforts and participation. Thank you very much, and enjoy this afternoon in Riga, and have a safe trip back home. And last but not least, I want to thank for all team, our team, Ministry of Health and Center for Diseases Prevention and Control. You did a great job. You were brilliant. We are brilliant. We are a team. Thank you very much.